Good afternoon, Dr. Isha. So let me first introduce to you to the viewers for more information. So this is Dr. Isha Khetarpal. She's practicing with the Khetarpal Nursing Home near Rajouri Garden. And today we are going to discuss more on pediatrics and neonatology. Ma'am is holding a vast experience of more than 16 years, and she is actively associated with NDCHRC. So a warm welcome once again, ma'am.
Thank you.
Yeah. So, as you know, more new parents are, little worried about their kids' vaccination, and definitely they require more tips. So today, let me discuss one point so that it's easy for them to, go through their life cycle. Yeah.
Right.
Would you like to say something before we start off?
No, I think we can just start with the questions. I think we're good.
Yes. So most of the parents are very, very much curious about, why it is mandatory to have vaccines, and is it very necessary? So what do you think about that?
So vaccines are made against the reason for making vaccines in the first place is to prevent life-threatening illnesses. So as science has progressed, so the first vaccine we made was BCG, that was against tuberculosis, which used to be a life-threatening illness earlier, a few decades ago, in fact. Now, due to the success and the universal coverage of BCG, we see such less, the cases of life-threatening tuberculosis have decreased significantly. So all the vaccines which are made, like nowadays, we can also take the example of COVID. So we know
Yes.
COVID has been a life-threatening illness for the whole world. So which is why there was such a rush to make a vaccine against the illness so that we can prevent the illness from occurring altogether, so that we can decrease eventually the morbidity and mortality of children all over the world. So which is
Of
why
course.
vaccines are very, very important for
Mhm.
all children. So
So,
they should never be missed. And sorry, yeah, tell me.
so COVID vaccines are under process for the kids, for the smaller ones.
Yes. So every vaccine or every medicine does come a little later for children because safety and efficacy studies for children usually take longer. And we have to study effects over time and on adults first. First the animal studies, then there are studies on sick individuals, then humans, and then it comes to children. So it takes a longer time for efficacy studies and safety studies to come for children. So
Sure.
yes, they are under process, and I think they should be available soon.
All right. I hope most of the answers has been cleared now. So, secondly, when parents, first time parents would be much curious to know when does my child starts talking or seeing or hearing. That is again a
Mhm.
one most important thing to be noticed. So, can you just brief about when exactly the child would be
There's
interacting?
several things. We know that children start hearing inside the child's womb or the mother's womb. Sorry. So as we know, the Bhagavad Gita also talks about Abhimanyu hearing about how to break the Chakravyuh inside his mother's womb, but he could not hear how to break it out or break out of it. So that is in fact true. Children start hearing from about 20 weeks onwards
Okay.
inside the mother's womb, so which is approximately halfway of pregnancy. And
About seeing.
seeing, seeing children start seeing. So once they come out, like as soon as they are delivered, they in fact initially see real images. That would mean that they see us upside down, and over time, that about a week or a few days, the image starts processing the image into an inverted image, which is how we see ourselves now.
Okay. Okay.
So as soon as the baby is delivered or born, the babies can start seeing if everything is normal.
Okay. Okay.
And when it comes to talking, so talking is actually an acquired milestone, so
Mhm.
which is very interesting. So all children will develop different milestones of talking. So by about 3 months of age, you will start noticing that this child starts babbling, like
Yes.
anga angu ma ma ba aisa
And
karke.
sounds.
Then by about 6 months they have monosyllables. By 9 months they start bisyllables. They start saying mama, dada, baba. Up till 2 years of age, in fact, is the time that the children have very fast language development. From 1 to 2, they
Okay.
develop their social and language milestones very fast. So that is when they'll start talking very well. So basically, by around 2 years of age, your child should be speaking about two-word sentences, should be asking questions. They'll learn, as fast as one word a day, and they will also start, responding to commands. Like you
Okay.
can give them one step
So
and
maybe
two-step commands.
once parents start communicating more, it will be helping them
Definitely,
to quickly pick up. Okay. Okay.
definitely.
So I think
So, which is why we always say that even from the pregnancy onwards, like 20 weeks onwards, since once they start hearing, they are able to perceive
interact better.
language.
Okay. Okay.
So,
That's
it is a progression, and your child should be following the milestones approximately.
nowadays it has been seen that most of the parents say that it takes a bit much more time. So is there something
Mhm.
psychologically related to it? Because in the earlier days
Yeah.
kids used to pick up fast. So is there any
Yes.
significance in that area?
Yeah. So two, three things have happened. So I think nuclear families, children, have less exposure to more people.
Okay.
Then COVID, this is one of the effects that we are seeing very regularly. After the lockdown, all the children, the time that they should have been developing, they should have been exposed to more stimuli, so many more things, and
Correct.
so they were just shut down without any stimulation, in front of screens, in front of just parents who have to work from home in a new environment which is alien to us. So
Correct.
we are seeing too many children who have had developmental or language and social delays after the lockdowns. So if your child does not, or if children do not, or you feel that the child is behaving abnormally or different from other children, you should speak to your pediatrician. They
Okay,
should
okay.
be able
So
to help
this is
you
a
out.
very important thing to be definitely,
Yeah,
all the, parents definitely keep a note, because I think most of the cases are rising, like where there is a lot of
definitely.
difficulties, right? So maybe
Yeah,
early detections can really help them.
bilkul.
Yeah.
Early
So
detection and early intervention. So that is the most important thing,
yes,
because then we are able to salvage maximum.
correct. That is a very, very definitely going to help them out. Just a moment. So again, a very common question: why do kids start sucking their thumbs, and they are more dependent on the teethers and kind of thing. So do you have any kind of a suggestions for that, or anything to be replaced? Because it doesn't look good if they are prolonged on that.
Mm-hmm. So, most of the times children grow out of it. It is
Mhm.
also a milestone, as we say. So, thumb
Okay.
sucking or mouthing. So, about 4 to 5 or 5 to 6 months of age, children bring their hands together and they start looking at their hands. We call that hand regard.
Okay.
Then, by about 5 to 6 months, they start putting everything in their mouth. So that is also, that also sort of gives us an indication that the child is now ready to feed. So you can
Okay.
start to introduce food. So in fact, it is a milestone. This is how
Okay.
children develop. So we shouldn't worry about children putting things in their mouth, because that's normal. But yes, we should see that the things that they are putting in their mouth should be clean, and because that is the time that they start catch their infections most commonly, like the viral diarrheas and all of that, which parents actually attribute to teething. Is in fact, children feel irritated in their gums, and they'll put anything in their mouth to try to soothe it, and that leads to infections. So it's
Right.
not related to teething per se, but leads it's because of children putting things in their mouth. As in how children grow, they just grow out of it. Also, thumb sucking is also nothing that you're worried about until that it leads to abnormal dentition. So if the
Yes.
teeth become abnormal, only then we worry about it. Otherwise, they'll grow out of that
That's
also.
absolutely fine, right? Okay.
Yeah.
So, is just something different. Like, is there something like some oral hygiene can be taken care? If in case there are some concerns, then parents can
Yeah.
do something to clean orally. They can
Yeah,
use
so that's
something.
actually a very good
Hmm.
question. They should do that from birth onwards. In fact, like, from 1 to 2 weeks only, the mother should use her own finger, like clean
Mm-hmm.
it, wash hands properly, and
Okay.
they can massage the gums so that
Okay.
the child becomes used to, put having a toothbrush and, dental hygiene, as well as they'll get rid of any, stuck particles.
Okay. Okay. That can be started
And
as early as you said.
as early as 2 to 3 weeks of
Oh,
birth.
that's good. I think.
And as soon as the child starts teething, we can use a finger toothbrush, then a baby toothbrush, and with soft bristles. And
Mhm.
initially, the toothpastes that we use are very important. We should use fluoride-free toothpastes.
Okay,
That
very
would mean that,
important point to be noted. Yeah.
yeah, yeah. So fluoride-free, because even if the
Okay.
child swallows it, it will not cause any harm. The
Okay.
usual
Okay.
toothpaste that we use are with fluoride,
Okay.
so that we cannot swallow.
Correct.
So
Correct.
little children will not spit it out. So even if they swallow fluoride-free toothpastes,
Okay.
which are usually the baby toothpastes,
Mm-hmm.
it's fine. It
Okay. Okay.
it won't lead to any
I think
problems.
parents out there, it's going to really help them to start with the little small hygiene things at the starting itself. Now,
Yeah, definitely.
nowadays you can see kids are very fuzzy eaters. So, is that this some kind of Horlicks, Bonvita, these kind of food are recommended, or does it help the kids in development, child development?
No, there are no studies which will tell you that it helps in child development. Child
Mm-hmm.
development is a process of stimulation and proper nutrition and micronutrients.
Mm-hmm.
So yes, it can help in providing micronutrients, but I always say that you should try to complete the diet
Mm-hmm.
by using local foods rather than using expensive foods like Boost and Horlicks,
Okay.
which everybody may not be able to afford. So you should use local ingredients like maybe jaggery or maybe
Okay.
even sugar, or
Mm-hmm.
you can make the food more nutritionally dense, giving thicker foods and
Mm-hmm.
using the foods that are available in your market locally, like Boost and Horlicks,
Any kind of
which
vegetable
actually have no
purees and
studies.
all.
But yeah,
Mm-hmm.
if you can use those to make the milk more palatable to the child, that's fine. It just gives some added calories, that's also fine, right? But it's not like these are like a go-to thing to help your child grow. That is not the case. So
Yeah.
rather use the things that you use for your family to use at that you give at home for everybody, like family feeds. Basically, that is the most important thing,
Skincare.
rather than going for fancy things like Boost and Horlicks. They can be given, but there's no evidence to suggest that they will help in growth and development.
Correct. So yeah, because it's a modern trend nowadays, right? Everybody prefer to go. So definitely, please, parents, take care of your kids and go by the natural food which is available at your home. Now, I think we have covered most of the aspects, and there are certain things like what are the best ways to start pampering your child, or what kind of a massage, or what attention or stimulations need to be taken care, so that certain tips, like now the climatic changes are coming in. So what kind of a precautions you would suggest, or tips, so that definitely we cannot avoid any kind of diseases, but definitely to keep them away. You can please elaborate on that.
Hmm. So preventive aspects are always better as compared to treatment,
Mm-hmm.
definitely, because prevention is the best cure. And one, I think you should not delay your child's vaccination, which is very important.
Mm-hmm.
Two, the dengue is quite bad
Very.
this time in Delhi, and or your according to your geographical areas, the like certain areas are more prone or endemic for malaria, certain areas are more endemic for dengue. So we have to be careful of those illnesses, and so full sleeve clothing, mosquito repellent nets, or nowadays you have these stickers and things also which you can put on your child's clothes, so
Yeah.
that it does not contact the skin also, and that does its work. So these are also good. uh, frequent or proper hand washing, and a lot of children, like we get a lot of patients who come in who say कि बच्चे को निमोनिया था या बच्चे को सर्दी खांसी तो इसलिए हमने उसको नहलाया नहीं. तो आई सिंपली से कि इन्फेक्शन को और बढ़ाने की चीज से कोई फायदा नहीं होता है. तो यू शुड मेक श्योर दैट यू फॉलो
Proper
hand
hygiene.
hygiene and personal hygiene, because
Mhm.
if you don't give a bath, that's not going to help or prevent infections at all. You will in fact be introducing more infections to the
Correct.
child. So you should give a bath. Like, we don't live in an area where we can avoid baths for longer time because we are very populated, and dust,
Yes.
our country has a lot of dust and problems. So we should take regular baths and take care of personal hygiene. So that is very important. And as I said, that you should vaccinate your children. This is a good time for flu vaccine also.
Yeah.
So the flu vaccine is a vaccine which should be given uh, for all children,
About.
especially this year.
Okay. Any
So
age
it's a
particular to
yearly
start off
vaccine,
with? Any particular
6
age to
months
start?
onwards.
Okay, first year
6 months
onwards.
onwards.
Okay, okay.
Yes, no, 6 months.
This
Six
is
months
something
onwards, take a
beyond
flu
your
vaccination.
regular, chart of vaccines, right? So
Yes,
this
so
can
this
be
is an
given every
optional
year.
vaccine. Yes. So it should be given to all children regularly who have any kind of pre-existing illnesses, including asthmas,
Okay.
every year.
Hmm.
And otherwise, it is an optional vaccine we may or may not give. But it is, again, as I said, all vaccines are made for life-threatening illnesses. So no vaccine is a bad vaccine. You should give all. In fact, uh, the government programs have to be done, and optional vaccines you must consult your pediatrician, and they will be able to guide you the best according to the requirements of your child.
Sure.
Oh, and we spoke about stimulation exercises. So that is a very wide topic that you can do. So a few things, tips that I can give. So there's several kinds. So basically, we have 5 senses that we must utilize, right? So hearing, vision, tactile sensation, so taste, and all of these senses basically have to be utilized. So stimulation is basically giving varied stimuli, like all kinds of stimuli in different ways to the child to ensure optimum brain development or the best brain development. So it can start from as early as once the child starts hearing inside the baby's the mother's womb. So where you can talk to the child and sing to the child, and once the baby is born, uh, while breastfeeding, the mother can always speak to the
Communicate.
child, stimulate the child, and caress the child. And it's not just the mother's job. In fact, it is the whole family's job, which is in fact even better, because everybody will have something new to offer to the child, which will be a new stimulus for the child, for the baby.
Correct.
Then we can give tactile stimulation by or kinesthetic stimuli by massaging the babies,
Yeah.
and while we are massaging, we can make it an or, storytelling in fact is a very good thing, which can be an interactive session. And as the child grows, we can introduce them to different environments, different tactile sensations, like something is smooth, something is rough, something is muddy or soft. So all of these things have to be introduced to the child so that the child can develop optimally.
Yeah. So I think a lot of important things been shared today, and definitely parents would be benefiting out of the most of the things discussed today. And further, we would like to have further more conversations in future. And is there something which you would at this particular point you would like to share just one thing, one point to remember for the parents, so that they can have a very comfortable kind of, because most of the parents say that why does my child don't sleep, why they are there is a lot of disruption. I know it's like a very common thing nowadays, but is there something as a pediatrician, and you can be the best guide for them, so is there something which they can take away?
So, children sleeping in the daytime and being awake in the night is something normal, as
Okay.
mothers or as expectant mothers would testify that when they would be or when they are awake in the or roaming around in the day, the baby is all quiet and not doesn't move much. Whereas when the baby or when once they lie down in the night, that is the time that the babies start kicking and moving about. So all, expectant mothers would testify to that. That happens because, you understand that we give jhule, like, we give,
Yeah, there's this
it's
swing.
like a swing to the baby. So they are asleep during the day when the mother is, active and roaming around. They feel that it's a nice swing that we are getting, and they'll, be asleep most of the night and most of the day. And once they, the mother is away or asleep in the night, that is the time that she's not moving about much, and that is the time that she'll start having, the baby starts moving, because the swing has
There is a
stopped and
complete
the baby is
silence.
upset.
Okay.
Yeah. So that takes a while for children to grow out of. Some people or some children may respond as early as 5 to 6 months, and some children even may take up to 3 to 4 years. So you just have to be lucky in that.
Sure. So every parent will have a different experience altogether.
Different.
But yeah, definitely, if there is something, doctors like you are available, then to help them out. So I would definitely recommend everyone to be getting associated with you, and we hope to see you in more conversations further. Yeah, all the best, ma'am, and thank you so much for your time and all the
Thank you
points.
so much to Prabisha and Mr. Pratyush and everybody for inviting me and letting me have this talk.
Sure, ma'am. Sure, definitely. So, all the best, and thank you so much once
Thank
again.
you.
Yeah, bye bye.
Thank you. See.
All right.
Oh.
Thank you.